Hi, everybody. I'm Dr. Seth, clinical psychologist, and today I'm going to talk a little bit about the relationship between ADHD and drugs and alcohol. So, I'm Dr. Seth Meyers, and I do the weekly mental health podcast called Insight with Dr. Seth, and we talk about mental health topics every week. And in this video, I'm going to talk specifically about some of the risks associated with having ADHD. And one of those is that an individual with ADHD may be more likely to try to self-medicate with alcohol or drugs. Now, what is ADHD? ADHD is a neurodevelopmental disorder. It must be diagnosed by a licensed professional, and the best way to test for ADHD is not just a clinical interview that uses the self-report of someone, but it's also a continuous performance test. As an example, neuropsychological testing that helps a licensed professional understand if there is sound data to support an ADHD diagnosis. Now, if you are someone who has been diagnosed with ADHD, ask yourself about what your drug or alcohol use is like. Are you someone who never drinks? Are you someone who never uses drugs? And if you do drink or use drugs in any way, ask yourself, if you feel that you have a problem, or if anyone around you has ever suggested that you may have a problem, ask yourself, what are the reasons why you may have used alcohol or drugs when you have? As an example, someone may use alcohol in a normal way that is not dangerous, which is to say, maybe they go out to dinner on a Saturday night and perhaps they have a glass of wine. Why do they drink the alcohol? They do it maybe once or twice a week to have a drink or two because they enjoy it. Someone who has a problem with alcohol or drugs, someone who uses them in an unhealthy way, does it to escape from the way they feel in their body, from some of the thoughts they're having. They do it as an escape to self-medicate. They tell themselves that this is the medicine that they need to feel okay. If a person has ADHD, it can cause a lot of frustration and anxiety. It can cause a lot of interference in one's daily life. People around the person with ADHD can get really frustrated. They may say things like, why don't you ever follow through on anything? I can't give you any project. You can't manage anything. Why do you forget everything? Why do you act like you don't listen to me? Or you look like you don't care when I'm talking. So the person with ADHD can actually live with a lot of frustration. Now, the question is, how frustrated does the person feel? Is it something that they feel every day? Do they feel like they sometimes turn to alcohol or drugs just to get away from the demands of life, just to get away from the reality of life, because reality is too much. Reality is overwhelming. Does it feel sometimes like the walls are coming down, like there's too much pressure? Well, if a person feels some of those things, they may be more likely to turn to alcohol or drugs, but that is not a healthy response. It is not good for anyone to engage in writing their own prescriptions for things that can alter their mood. So this isn't someone saying, you know what, I feel overwhelmed, so I'm going to go for a run. This is someone saying, I am going to turn to alcohol, which can cause all sorts of negative consequences if it's abused. I'm going to turn to that to help me cope. That is not good for a person. And a person who has ADHD symptoms that are not managed well can be more likely to turn to some of these things in a really unhealthy way, in a way that may be dangerous, and also in a way that can create arguments and conflicts with others. Turning to alcohol or drugs when you have ADHD and self-medicating in this way can also end up preventing you from meeting some of the requirements that you have in your daily life. Perhaps it starts showing up by you're not showing up for work, or perhaps You're coming home hours late when someone's expecting you, but it can start to cause impairment in your work life, in your school life, in your social life, in your romantic life. Be very careful if you are someone who has been diagnosed with ADHD to make sure that you find healthy ways to manage it. Now, some people use medication. They meet with a medical doctor or a psychiatric nurse practitioner to go over options and to determine if that's the right thing. Some people use cognitive behavior therapy. Some people turn to online support groups for ADHD management. There are all sorts of healthy ways an individual may be able to manage their ADHD, but self-medicating with alcohol and drugs is simply not one of them. If you have any questions about whether you have a problem, in the description for this video, I will post a couple of references that you may find helpful. I hope this video has been helpful.